So our next speaker is Dr. Tom Sisson and Dr. Shijing from the Adult Program. So I'll go ahead and take it away.
Oh, I'm sorry. I was supposed to introduce them. Yeah, Dr. Sisson is the CF Adult Program Director, and Dr. Gia is the Associate Adult Program Director. Sorry about that, guys.
No problem. Thank you, Samia. And I'm really excited to be here tonight and to share our adult program update. And thanks to all the patients and families for joining us. I know there's a lot of distractions in the world right now, many of them really unsettling. So we appreciate you being here with us. And I'm going to start out and then turn the talk over to Dr. Gia towards the end. So this is the outline of what I want to cover. First, in case you're not familiar with our adult team, I want to introduce all the key members and then touch on how our adult clinic is growing quite rapidly and how we're strategizing to make sure that we have adequate providers as we look towards the future. And then talk about some quality improvement initiatives in our own clinic. And then finally, I'll turn it over to Dr. Gia to talk about some of the adult research activities. So this is our awesome team. At the top here is Katie Hall, who is our clinic or center coordinator and one of our social workers. She works with Mara Pitcher, another one of our social workers, help patients with social work and mental health issues in the clinic. Ronnie Downer is our nurse. If you're not in the adult clinic yet, you'll definitely get to know her when you transition. Becca Aiello is new to our clinic in the last year. She's a respiratory therapist. Bisha Allen is a medical assistant in the clinic who helps us organize our clinic days. And then Linda Fitzgerald and Krista Walter, as Dr. Nasser talked about how important pharmacists are. Linda and Krista provide us pharmacy support, and I can attest to the value that they really provide to us in many domains, including modulator initiation, but also drug-drug interactions and starting antibiotics. Candace Flaherty runs our registry. Kristen Keith is our physical therapist who keeps everybody's bones and joints in line, including all the providers. Then Ian Ong is our fantastic dietitian. These are the physician providers who you may see if you come to the adult clinic. Sarah Brown is our newest addition. She joined the clinic about a year ago. Michael Coffey and Cyril Groom have been with the program for several decades. Yvonne Wong has now been with us also for quite a number of years and came to us from California. And then Shijing, you'll meet shortly, has been with the program also for several years and was one of our fellow graduates. And then, of course, myself. And these are the ancillary providers that we really rely on to help optimize our care. Mel Sagana is our lung transplant pulmonologist. We have 2 endocrinologists who help us with CF-related diabetes and bone disease. That's Zara Sanduk and Jennifer Wyckoff. Dr. DeMagno helps us with gastrointestinal issues. Then Mark Zaharik is our sinus expert. In this graph, I just wanted to show how our clinic is growing. This is the total number of patients that we've had in the clinic over the past 10 years. This is actually an underrepresentation because this is registry data, and not every patient we see is in the registry. But you can see that we've increased by 90 patients over the last 10 years. And so if we look forward another 10 years, we're going to be over 400 patients. And although we have a very robust team, we're definitely going to have to grow to accommodate this expansion. One of the ways, at least from a physician perspective, that we're strategizing is by trying to recruit some of our own trainees. And particularly, we're looking to recruit some of our pulmonary fellows. So not everybody knows what a pulmonary fellow is. Just gave a little bit of a timeline to show you where a pulmonary fellow is in their education. So these are individuals who've gone through college and medical school and done an internal medicine residency program, and then are doing 3 years of subspecialty training in pulmonary and critical care. And our hope is that we can recruit some of our own fellows to practice in the domain of cystic fibrosis. That really requires us to provide increased exposure for these individuals to CF care. And you can see in this table below, we recently were fortunate enough to acquire a foundation-sponsored fellowship grant. Before this grant, our fellows had very little exposure to cystic fibrosis. We recruit 5 fellows per year, and in the first year, those 5 fellows maybe saw cystic fibrosis patients for about 10 total hours. Then in the second and third years, maybe 5 hours where they might have been randomly exposed to a patient. With our fellows clinic now, we intentionally are exposing all the first year fellows to CF care in the outpatient setting and also in the inpatient setting. And then from these 5 fellows, our goal is to recruit 2 of them to participate in a dedicated clinic, which I'll describe a little bit more on the next slide. In these clinics, we'll have 2 fellows that spend close to 100 hours on CF care. They'll also attend our national conference. These same fellows will also continue with CF care as third-year fellows. Thus far, we've had 1 fellow start in the CF Fellows Clinic, and this is Dr. Wang. You can see her patient panel is steadily growing. She's up to 10 patients now. And starting in July, we're going to have a second fellow, Dr. Colby, start with us as well, and she'll begin to see patients with our ultimate goal of recruiting one of these individuals to eventually join our practice so we can accommodate the increase in growth. So changing gears a little bit, I wanted to talk about our quality improvement initiatives in the clinic. For several years now, we've had a quality improvement project around transplant education and referral. It was recognized that we had a relatively uncoordinated approach to transplant education and referral. And under the leadership of our QI team, what we've developed now over the past few years is a program where all adult patients receive transplant education, recognizing that many, if not all, the vast majority, won't ever need a transplant. We do want to normalize the education around this process, just in case an individual may develop advanced lung disease and need to proceed down this avenue. We're also now referring patients with advanced lung disease earlier so we can identify any barriers that might prevent them from being listed. And this gives them time then to work on those particular barriers such that they'll be optimal candidates should they reach a stage where they do need a transplant. And those patients that have been referred, we're now having see Dr. Sagana yearly so that he can monitor their health and make sure that they are listed at the optimal time. A more recent quality improvement initiative is to optimize our antibiotic duration. And this has really been motivated by the results of a clinical trial that was published called the STOP2 trial. And in this trial, the researchers basically compared short courses of antibiotics in patients who evidence of response to treatment versus longer courses in patients who didn't respond. And what they found was that in 10 days of antibiotic treatment was equivalent to 14 days in individuals who showed a rapid response to treatment for their CF exacerbation. And those who didn't rapidly respond, that 14 days of treatment was equivalent to 21 days. So we're really trying to implement this in our clinic with a goal of shortening the antibiotic courses, realizing that the longer courses weren't making any difference, and those longer courses are associated with potential side effects from the antibiotics, but also contribute to the burden of treatment. So this is an ongoing process, but we made nice progress recently. As Dr. Nasser showed you data from her program, we also are very committed to tracking our own outcomes. I just show a few slides here. One of the most important things we monitor is lung health, and one of the most important parameters of lung health is FEV1, which is a volume that we measure in the PFT lab or with the home spirometer. And as Dr. Nasser showed, each one of these individual bars is a center across the country. And this red bar is where we lie. You can see we're doing very well compared to the rest of the country. And excitingly, you can see that over the past couple of years, our lung function is going up. This is really in part a tribute to Trikafta becoming available to our patients. We've also been monitoring pulmonary exacerbations over time. And again, we're the red line here, and we were tracking pretty closely with the national average here. And then when Trikafta came out, we had a nice decrease. So the percent of people who are having exacerbations every year has really nicely decreased. And as Dr. Nasser mentioned, for the PEDS program, we've also been really trying to adjust to the pandemic and trying to mesh with our patients' needs. This includes providing flexible visit options. Unlike the pediatric program, we try to coordinate all the providers to be either virtual or in person on a particular day. And this summer, our goal is to go to a 3-to-1 ratio of in-person to virtual appointments, with the second Wednesday and Thursday of the month being our virtual day. We're committed to continuing to provide virtual care. It's actually something that our Department of Medicine also is really pushing for. And because we're providing virtual care, we still want to make sure we're collecting critical data on our patients. Dr. Nasser mentioned the home spirometer program in the PEDS clinic. We're also working on a program to really facilitate this in the adult program, and that's led by Becca. In addition, we're really also striving to capture culture data from patients who either don't want to come to clinic because they're still concerned about the pandemic or because they live in more remote areas. And we did send out 200 culture kits in the year after the pandemic. And our return rate was not where we wanted it to be. So this is something we're really trying to work on with our adult patients, such that this can be a mechanism by which we collect data. Culture kits that were returned actually gave us good results and showed similar positivity rates to the cultures that we were collecting in clinic. And here I'm going to stop and actually turn it over to Dr. Gia. And I'll turn the slides for her.
Great. Thank you, Dr. Sisson. So first, I just wanted to mention that the Cystic Fibrosis Foundation recently issued the ENT multidisciplinary consensus recommendations for people with CF. And our very own Ronnie Downer was part of the expert panel and thus is author of that publication. So We wanted to thank her for her hard work and also that we're very proud that she's representing the University of Michigan on a national and international level. And of course, the adult program continues to partner closely with the pediatric program under Dr. Nasser's leadership in multi-center clinical trials to advance the care for people with CF. Next slide, please. So one of the multi-center studies that our pediatric and adult program participated in, which I wanted to highlight, which some of you may have been a part of actually, is a study that looks at the complication rates of repeated PICC lines in people with CF. So this particular study enrolled 252 patients from 10 different CF centers across the United States. And we found that complication rates associated with PICC lines in CF patients are really quite low, with bloodstream infections, with 0% bloodstream infections, very few clotting events, and over 300 PICC lines placed. So most issues noted in this study were minor and associated with skin irritation or minor catheter malfunctions. So these study results were published in the most recent NACFC meeting. Next slide, please. So we also strive to answer clinical questions by looking at our clinical outcomes here locally at the University of Michigan, in addition to participating in multi-center studies. So here's a study where we presented also at NACFC that showed that there's an improvement in hemoglobin, which is the first graph on the left, and other markers of iron deficiency anemia, such as iron levels, which is the middle graph, and transferrin saturation levels, which is the graph on the right, in people with CF after starting Trikafta. So we're currently working with 3 other CF centers to collect broader information about this so that we can publish this information and make this more available for other CF clinicians. Next slide, please. Another study we embarked on this year was the question of sputum culture clearance after starting Trikafta. So this is our very preliminary data that was presented as well at NACFC. It appears that there might be less frequency of organisms like Pseudomonas on the left and MRSA in the middle and Stenotrophomonas, just to name a few, that grow from sputum or throat cultures from our patients after starting Trikafta. This is really preliminary, and we're very interested to see if there's a clinical difference in patient outcomes related to these sputum culture results. So these are just some of the examples of the exciting research that the entire CF community is undertaking to ultimately improve health for people with CF. Next slide, please. So in summary, the adult CF program at U of M is growing, and we continue to work towards providing the best quality of care to our patients. We remain committed to quality improvement initiatives as we take care of more of our patients. And our dedication to CF research, both through participating in national studies and local projects, promises to improve the lives of people with CF even more. So with that, I will turn it back to Kathy Enox. Thank you very much, everybody.